Today we're going beyond just managing your blood sugar. We're doing a deep dive into metformin, a medication that's making waves for its potential benefits that go way beyond what many people realize. Now, you want to understand the science behind metformin in a way that's easy to grasp. So we've got just the person to help us unpack it all.
That's right. There's a lot of buzz around metformin, and we're learning more and more about its potential.
If you're new to the channel, be sure to hit that subscribe button and the notification bell so you don't miss out on any of our future deep dives. Let's start with the basics. Most people know metformin as a treatment for type 2 diabetes. Can you walk us through how it actually works to lower blood sugar levels?
Absolutely. In type 2 diabetes, the body cells become resistant to insulin. Insulin is like a key that unlocks the doors of our cells, allowing glucose from the bloodstream to enter and be used for energy. But when cells become resistant, the key doesn't work as well, leading to high blood sugar.
So it's like the cells are ignoring the insulin signals,
Yeah.
and glucose builds up in the bloodstream.
Exactly. Now, metformin tackles this problem in a couple of clever ways. First, it acts on the liver, which is responsible for producing glucose. Metformin essentially tells the liver to slow down its glucose production, preventing excess glucose from entering the bloodstream.
Interesting. So it's like metformin is putting a gentle brake on the liver's sugar output.
That's a great way to think about it. But metformin doesn't stop there. It also works to improve how the body uses insulin, making those cells' doors more responsive to the insulin key. It does this by increasing the number of glucose transporters on cell surfaces. Think of them as additional doorways for glucose to enter the cells.
So metformin is a multitasker. It reduces glucose production in the liver and simultaneously improves how the body utilizes insulin. It's like a double-pronged approach to tackling high blood sugar. Now, I know you're eager to learn more about how this impacts you directly, so make sure you like this video and share it with anyone who might be interested in learning more about metformin. Now let's move on to another area where metformin is gaining attention: weight loss. Many people are curious about its potential in this area. Can you explain the connection?
Metformin isn't directly a weight loss drug, but it's often used off-label for weight management, especially in people with insulin resistance. You see, when cells are resistant to insulin, the body tends to store more fat, particularly around the abdomen.
That makes sense. Insulin resistance disrupts the body's natural way of managing energy.
Precisely. And because metformin improves insulin sensitivity, it can indirectly lead to weight loss, especially when combined with lifestyle changes like diet and exercise. Some studies have shown that people taking metformin alongside a healthy lifestyle experience modest but consistent weight loss.
So it's not a magic bullet, but it can be a valuable tool for those struggling with weight management, particularly if insulin resistance is a factor.
Exactly. It's important to remember that metformin works best as part of a holistic approach that includes healthy eating and regular physical activity.
Now let's shift gears and talk about insulin resistance itself. We know it's a key player in conditions like type 2 diabetes, but it also seems to be linked to a whole host of other health concerns. Can you shed some light on why insulin resistance is such a big deal?
Absolutely. Insulin resistance is at the root of many metabolic disorders, including type 2 diabetes, PCOS, and even non-alcoholic fatty liver disease. When cells become resistant to insulin, it triggers a cascade of problems. The pancreas has to work overtime to produce more and more insulin, trying to force the cells to respond. Over time, this leads to chronically high blood sugar levels, increased fat storage, and other complications.
So insulin resistance sets off a chain reaction that can really impact overall health.
Exactly. And that's where metformin steps in. Remember how we talked about it improving insulin sensitivity? Well, that's a key mechanism for tackling insulin resistance by enhancing the cell's responsiveness to insulin. Metformin helps break that vicious cycle and improve metabolic function.
It's like metformin is helping the body restore its natural balance.
That's a great way to put it. And research has shown metformin to be effective in reducing insulin resistance across various populations, both with and without diabetes.
That's incredible. It really highlights the potential of metformin beyond its traditional role in managing blood sugar. Now, before we delve deeper into those fascinating aspects of metformin, I want to remind everyone watching to hit that like button and subscribe to the channel for more in-depth health discussions. Now, one of the things that surprised me was learning about metformin's impact on hunger. Can you explain how it works in this area?
You see, hunger is a complex process regulated by our bodies, involving intricate communication between the gut and the brain. Several hormones play a role in this gut-brain signaling, including ghrelin, leptin, and GLP-1.
So where does metformin fit into this intricate web of hunger signals?
Metformin appears to influence this gut-brain connection. potentially altering the gut microbiota in a way that promotes feelings of fullness and reduces appetite. It's also been shown to boost levels of GLP-1, a hormone that not only helps regulate blood sugar, but also plays a crucial role in promoting satiety, that feeling of being satisfied after a meal.
So it's like metformin is sending a message to the brain saying, hey, we're good here. No need to send out any more hunger signals.
That's a good way to visualize it. While the exact mechanisms are still being investigated, research suggests that metformin can have a modest but consistent effect on reducing hunger and calorie intake.
That's fascinating. It's amazing how a single medication can impact so many different aspects of our health.
And there is another fascinating aspect of metformin's influence on the gut. It seems to promote a healthier balance of bacteria in the gut microbiome.
You've mentioned the gut microbiome a few times now. Why is it so important for our health, and how does metformin play a role?
The gut microbiome is like a vast ecosystem of trillions of bacteria living in our digestive system. These bacteria aren't just passive residents. They play a crucial role in everything from digestion and nutrient absorption to immune function and even brain health.
It's incredible to think that these tiny organisms can have such a significant impact on our overall well-being.
It really is. And when this delicate balance of bacteria is disrupted, it can contribute to various health problems, including metabolic disorders. Now, what's fascinating about metformin is that it seems to act as a sort of gardener for the gut microbiome, promoting the growth of beneficial bacteria. For example, it increases the abundance of a type of bacteria called Akkermansia machinifila.
Okay, that's a mouthful. What's so special about Akkermansia?
Well, Akkermansia is known for its anti-inflammatory properties. And remember how we talked about inflammation being a major driver of many health problems, including insulin resistance?
Right. Chronic inflammation is like a constant simmering fire in the body, disrupting all sorts of processes.
Exactly. So by fostering the growth of Akkermansia, metformin might be helping to dampen that inflammatory fire in the gut, indirectly contributing to its positive effects on insulin sensitivity and metabolic health.
So metformin's impact on the gut microbiome is like a ripple effect, influencing various aspects of our health. I'm learning so much. If you're enjoying this deep dive, be sure to hit that like button and leave a comment below. We love hearing from you. Now let's talk about something many people experience when starting a new medication: side effects. Are there any common side effects associated with metformin, and how can people manage them?
The most frequently reported side effects of metformin are gastrointestinal, such as nausea, diarrhea, and bloating. These side effects are usually temporary and tend to be more pronounced when first starting the medication.
That makes sense. Any new substance introduced to the body can take some adjusting to. Why do these gastrointestinal side effects occur?
It's primarily because metformin affects the way our bodies absorb glucose and can alter the composition of the gut bacteria. As we discussed earlier, these changes can sometimes lead to digestive discomfort.
So are there any strategies to minimize these side effects and make the transition smoother?
Absolutely. Starting with a low dose and gradually increasing it can help the body adapt. Taking metformin with meals can also be beneficial because it slows down absorption and reduces the potential for irritation. And for some people, switching to an extended release formulation known as Metformin ER can be a game changer. It releases the medication more slowly, preventing sudden spikes that might upset the stomach.
So start low, go slow, and time it with meals. Great advice. Now, what about alternatives to metformin? Are there other options for people who can't tolerate the side effects or are looking for different approaches?
There are other medications for managing blood sugar and improving insulin sensitivity. One newer class of drugs that's gaining popularity is GLP-1 receptor agonists.
I've heard about those. They're often mentioned in connection with weight loss. How do they differ from metformin?
GLP-1 receptor agonists work by mimicking a naturally occurring hormone called GLP-1, which helps regulate appetite, slow down digestion, and improve blood sugar control. They target different pathways than metformin, but ultimately aim for similar outcomes.
So they work in different ways, but can achieve comparable results. How do they stack up in terms of effectiveness and accessibility?
Metformin is generally more affordable and widely available, making it often the first-line treatment for type 2 diabetes. GLP-1 agonists, while potentially more effective for weight loss and offering advanced blood sugar management, come with a higher price tag and might not be as readily accessible.
It sounds like it's a matter of weighing the pros and cons based on individual needs and circumstances.
Exactly. The decision depends on factors such as blood sugar control goals, weight management needs, tolerance, and budget. It's essential to consult with a healthcare provider to determine the most suitable option.
Now, switching gears a bit, let's talk about polycystic ovary syndrome. or PCOS. I know a lot of women are curious about metformin's role in managing this condition. Can you explain the connection between PCOS and metformin?
PCOS is a hormonal disorder affecting many women worldwide. And a key feature of PCOS is, you guessed it, insulin resistance. Many women with PCOS have cells that don't respond well to insulin, leading to elevated insulin levels and hormonal imbalances.
So once again, insulin resistance is at the heart of the problem.
Precisely. And that's where metformin comes in. Its ability to improve insulin sensitivity can help address several key aspects of PCOS. By lowering insulin levels, it indirectly reduces the production of androgens, those male hormones that are often elevated in PCOS. This can lead to more regular menstrual cycles, improved ovulation, and even a reduction in excess hair growth and acne.
It sounds like metformin is addressing those hormonal imbalances at their root.
That's right. And remember how we talked about metformin's potential for weight management? This can be particularly beneficial for women with PCOS who often struggle with weight gain due to insulin resistance.
So metformin is like a multi-pronged approach to tackling the various challenges associated with PCOS. Amazing. Now, what about the interaction between metformin and exercise? Are there any special considerations when combining these two?
Both metformin and exercise are known for their positive effects on metabolic health. Exercise helps improve insulin sensitivity and glucose metabolism, while metformin works on similar pathways, reducing glucose production in the liver and enhancing insulin sensitivity.
So it seems like this should be a perfect match, working together synergistically.
You'd think so. However, some research suggests that metformin might slightly reduce certain exercise adaptations like muscle growth and improvements in aerobic capacity.
Interesting. Why might that be?
It's thought that metformin might interfere with some of the pathways involved in muscle recovery and growth after exercise.
So a potential downside, but probably not a deal breaker for most people.
Exactly. The combined benefits of metformin and exercise, especially for blood sugar control, far outweigh this potential drawback. It's all about finding a balance and working with your doctor to optimize your individual exercise plan.
So is there a specific way to combine these two for the best results?
Timing can be a factor. Some experts recommend taking metformin at a time that doesn't directly coincide with workouts, such as after a post-exercise meal. This allows your muscles to fully benefit from the exercise stimulus while metformin works its magic throughout the day.
That makes sense. And of course, consistency is key. Whether it's walking, cycling, strength training, or any other activity you enjoy, regular exercise amplifies the benefits of metformin for blood sugar control and overall metabolic health. Now let's discuss when someone might consider stopping metformin. Is it a lifelong medication, or are there situations where discontinuing it might be appropriate?
Stopping metformin should always be done gradually and under the guidance of a healthcare provider. Abruptly stopping metformin can cause blood sugar levels to rebound, especially if insulin resistance hasn't been fully addressed through lifestyle changes.
So it's not a decision to be made lightly. What are the signs that someone might be ready to transition off metformin?
Sustained improvement in HbA1c levels is a key indicator. HbA1c reflects average blood sugar levels over the past few months. If those levels remain consistently healthy without drastic lifestyle changes, it might be time to discuss tapering off metformin with a doctor.
But even then, maintaining those healthy habits is essential, right?
Absolutely. Lifestyle factors such as diet and exercise are the foundation for long-term blood sugar control. They can help sustain the improvements achieved with metformin even after discontinuing the medication.
Now, I've heard that metformin is sometimes used to prevent diabetes. Can you tell us more about its role in diabetes prevention?
That's right. Metformin is occasionally prescribed off-label for individuals at high risk of developing type 2 diabetes. This practice is supported by research, including the Landmark Diabetes Prevention Program, or DPP trial.
What did that trial reveal about metformin's potential for prevention?
The DPP trial showed that metformin significantly reduced the risk of developing diabetes, particularly in younger individuals and those with a higher BMI. This preventive effect is attributed to metformin's ability to improve insulin sensitivity and reduce glucose production by the liver, essentially nipping diabetes in the bud.
So it's like taking proactive steps to prevent a problem before it fully develops.
Exactly. However, it's important to note that lifestyle interventions like diet and exercise were even more effective in the DPP trial.
So once again, those healthy habits are the cornerstone of prevention.
Absolutely. Combining metformin with lifestyle modifications can create a powerful synergy, especially for those who find it challenging to maintain lifestyle changes alone.
It's all about finding the right balance and tailoring the approach to individual needs. Now, before we wrap up this segment, let's touch on a topic that often raises questions. Metformin during pregnancy. What do we know about its safety and effectiveness in this context?
Metformin is often prescribed during pregnancy for women with gestational diabetes or PCOS. Fortunately, evidence suggests it's generally safe and effective in these situations.
That's reassuring to hear. What are the specific benefits of using metformin during pregnancy?
It helps manage blood sugar levels, reducing the risk of complications like excessive fetal growth or preterm delivery. This protects both the mother's and the baby's health. Studies also suggest that metformin used during pregnancy may lower the risk of developing type 2 diabetes later in life for both mother and child.
Remarkable. However, I imagine it's still crucial for pregnant women to consult with their doctor before using any medication.
Absolutely. Every pregnancy is unique, and a healthcare provider can assess individual needs and determine if metformin is appropriate.
Now, before we move on to our final segment, exploring natural alternatives, I want to thank all of you for joining us on this deep dive into metformin. Remember, knowledge is power, and we're here to help you make informed decisions about your health. If you found this episode helpful, please hit that like button, subscribe to our channel, and share it with anyone who might benefit from this information. Let's spread the word and empower each other.
Now for our final segment, let's explore the world of natural alternatives.
We know many people are interested in exploring natural approaches to health. So, are there any natural alternatives to metformin?
There's definitely a growing interest in natural options for managing blood sugar and for improving insulin sensitivity. While metformin is a powerful medication, some natural interventions show promise.
What are some examples of these natural alternatives?
One that's gained a lot of attention is berberine. It's a compound found in plants like golden seal and barberry, and it's been studied for its blood sugar lowering effects. Some research indicates it might work similarly to metformin by activating AMPK, that cellular energy sensor we talked about earlier.
So berberine could be a potential natural ally in managing blood sugar levels.
That's right. While it's shown effectiveness in studies, more research is needed on its long-term safety and potential interactions with other medications.
Safety always comes first. What about other natural options?
Cinnamon is another popular choice. It's known to enhance insulin sensitivity, potentially improving how the body uses insulin and reducing those blood sugar spikes after meals.
Cinnamon, the space we use in baking.
The very same. While its effects are generally modest, incorporating cinnamon into your diet could be a helpful addition to other lifestyle changes.
That's interesting. Are there other natural contenders in this arena?
Alpha-lipoic acid is an antioxidant that's been shown to improve glucose uptake in cells, and chromium, a trace mineral, plays a role in carbohydrate metabolism. Some studies also suggest magnesium supplementation may help those with insulin resistance.
Wow, the natural world offers quite an arsenal. What about dietary changes? Can those make a difference?
Absolutely. A low glycemic index diet focusing on whole grains, vegetables, legumes, and healthy fats can be incredibly beneficial for stabilizing blood sugar levels and improving insulin sensitivity over time.
So it's about making those smart food choices. What about fermented foods? We hear a lot about those these days.
Fermented foods like yogurt, kefir, and sauerkraut are excellent for supporting a healthy gut microbiome, which, as we discussed earlier, plays a vital role in metabolic health.
So it all comes back to that gut microbiome connection.
Right. Pairing those dietary changes with regular exercise amplifies their effects, creating a solid foundation for long-term blood sugar control.
It's all about that holistic approach. Diet, exercise, and maybe even some strategic supplementation. But can these natural interventions completely replace metformin?
That's a great question. For individuals with prediabetes or mild insulin resistance, natural approaches might be enough to manage blood sugar effectively. However, for those with type 2 diabetes or more significant metabolic challenges, metformin remains the more reliable and thoroughly studied option. Natural interventions can complement metformin, supporting overall health and potentially enhancing its benefits.
So it's about working with your doctor to determine the best approach for your individual needs.
Exactly. It's also important to remember that some supplements like berberine might interact with medications, and even natural options can have side effects if taken in high doses. Regularly monitoring blood sugar is essential no matter which approach you choose.
Excellent points. Well, we've covered a lot of ground today, exploring the multifaceted world of metformin. From its mechanisms of action to its potential benefits and considerations, it's clear that metformin is more than just a diabetes drug. It's a complex medication with various applications and effects. What's the key takeaway you want to leave our listeners with today?
Metformin research is ongoing, and new discoveries about its potential benefits are constantly emerging. It's a fascinating area of study, and I encourage everyone to stay curious and informed about their health.
Beautifully said. We couldn't agree more. Knowledge is power, and the more we learn about our bodies and the options available to us, the better equipped we are to make informed decisions about our health. A huge thank you to our expert for sharing their knowledge with us today, and to all of you for joining us on this deep dive. If you enjoyed this episode, be sure to like, share, and subscribe to our channel for more in-depth explorations of fascinating health topics. Until next time, stay curious, stay informed, and take care of yourselves.